Hi, I'm Mary Markle, Lenawee ISD nurse. I'm also a certified family nurse practitioner. This offering today is dealing with chronic pain in the special education population. This offering is specifically designed for speech and language pathologists, and it will fulfill the new mandate by the state of Michigan that requires you have professional development in pain. So let's get started. So today's objectives: first, define pain and differentiate between chronic and acute pain. Identify common chronic pain conditions in the special education population. Describe how the student's interdisciplinary team can mitigate chronic pain special education students experience. Discuss implications the student's IEP may have in measuring the effectiveness of pain management strategies. Let's begin. So to address the issue for LISD students, a chronic pain work group was started in the fall of 2013, comprised of a PT, CODA, and registered nurse. We really wanted to look at this issue, but we found very little research in the specific area of chronic pain in the special education population. Further, a subset we were interested in were those students who were nonverbal with cognitive impairments. Focusing in on the problem, the relationship between a student's capacity to develop and learn and health and wellness is well documented and supported by much research. Therefore, it's important to develop communication strategies to determine the level of a student's health and wellness with an emphasis on the presence of pain and consequently interventions to help a student achieve the highest level of wellness possible each school day to promote optimal learning. In reviewing the literature, we found very little research in the specific area of chronic pain in the special education population. And further, a subset we were interested in were those students who were nonverbal with cognitive impairments, and there were even fewer resources we could find for this subset. So we decided to try to figure things out for ourselves. Let's begin by discussing what pain is. According to the International Association for the Study of Pain, it's an unpleasant sensory and emotional experience associated with actual or potential tissue damage. The inability to communicate verbally does not negate the possibility that an individual is experiencing pain. Pain is subjective. Very important to remember that. Acute pain may be mild and last just a moment, or it might be severe and last for weeks or months. In most cases, acute pain does not last longer than 6 months, and it disappears when the underlying cause of pain has been treated or healed. Unrelieved acute pain, however, might lead to chronic pain. The Cleveland Clinic has another definition when it comes to acute versus chronic pain. They're different clinical entities. Acute pain is provoked by a specific disease or injury, serves a useful biologic purpose, is associated with skeletal muscle spasm and sympathetic nervous system activation, and is self-limited. Chronic pain, in contrast, may be considered a disease state. It is pain that outlasts the normal time of healing if associated with a disease or injury. Chronic pain may arise from psychological states, serves no biologic purpose, and has no recognizable endpoint. Here's my cheap shot. Unfortunately, some physicians still do not believe children feel pain as acutely as adults, and it's estimated that only 45% of infant males receive any type of anesthesia prior to circumcision. There are also providers who do not believe children with disabilities feel pain as acutely as those without. So let's talk a little bit more about the fact that pain is subjective. So we're faced with the task of objectifying the subjective phenomena of pain to determine the right strategies and interventions to pursue. The experience of pain and its expression remains enigmatic. What can we do to actually provide objective information about the pain? How can we address pain if we're not sure what we're dealing with? Let's talk about some chronic pain conditions in the special education population. The biggie is cerebral palsy, and this in turn can lead to contractures that cause dislocated hips, musculoskeletal distortion, pressure on internal organs, etc. Skin breakdown related to immobility, belly pain related to chronic constipation, and here are some obvious objective signs when pain should be ruled out: crying, moaning, facial grimacing, and a little less obvious would be behavior problems, loss of appetite, nausea or vomiting, constipation or diarrhea, and depression. So thinking about assessment, step one and how our educational teams can mitigate. First, we need to know that a student is experiencing pain. This is why speech therapists are so critically important, especially for students who are nonverbal. Speech therapists can work with other team members to develop communication strategies for pain identification and to assess effectiveness of comfort measures. I want to shout out to Julie Mapstone, a pioneer in all of this. Julie has implemented a basic wellness scale, but she also has a visual that has more specific pictures and visuals. Let's remember every student is unique, as is every classroom. It's obvious that uniquely tailored communication languages are explored to determine the presence of pain. That's where our wonderful speech therapists come in. Our step two is interventions. What can we do if the presence of pain is established? It's always best to think of non-medication interventions first. And again, to shine a light on Julie, does the student have a personal care need? Does the student need to be repositioned? Can lighting be adjusted? Can the noise level be diminished? Can the use of therapeutic touch help? Julie has a systematic checklist she goes through. Also, we can consider application of heat and ice. A second tier of interventions would be medications, although good luck, sometimes it's very difficult to get prescriptions for. I really like the framework of the World Health Organization's stepwise approach to pain. First, the most common medications to consider are over-the-counter analgesics, ibuprofen but never on an empty stomach, and acetaminophen. We may see some PRN or as needed orders for muscle relaxers such as diazepam and baclofen. Rarely we see orders for narcotic pain medications, and if that's the case, we usually see this for pain associated with cancer. I want to focus for a minute on the pain associated with skin breakdown. Shut your eyes and take a moment to imagine the top layer of the skin over your tailbone is missing. There are many barriers that can be used, physical and topical, to promote the healing of breakdown, but since the number one cause is pressure, it's imperative to keep pressure off an open wound. In that wound, pain can be bad. So for us, thinking team approach, if a student is identified as having pain, the LISD nurse needs to get on it ASAP and begin to develop an individualized health plan. Like to work with speech and teachers to develop the language needed to identify and rate the pain, and also we need language to assess comfort measures. The IEP and chronic pain can't be addressed if team members don't know anything about it. It's imperative to have an ongoing conversation with parents about signs and effectiveness of interventions. Also, chronic pain can certainly be called out specifically in the IEP. So, in conclusion, we must all guard against becoming complacent to a student in pain. It is never okay to say, oh, that's just the way he is. He always screams after lunch, day in and day out. Pain must be assessed in all students with disabilities or complex medical issues, and a combination of scales and techniques must be used, maybe even invented, to assess pain. Thank you for your time and attention today. Fortunately, there's no post-test associated with this offering. So, all you need to do is shoot me an email, and I will get you a certificate of completion, good for 1 professional development hour in pain management, back to you as soon as possible. Please feel free to contact me with any comments, concerns, questions you may have in this area. We're learning more about this every day, and it's an area we must never become complacent about. Thanks again.